Prescribing a medication for pregnant women is a complex process. Before obstetricians and gynecologists decide which dose of which drug can best treat a condition without putting any harmful side effects on the mother and the baby, they consider the patient's age, general health, the number of months before delivery, tolerance for medications, and any other drugs the pregnant patient may be taking. Prescribing exercise on pregnant women has to be just as scientific and precise. The type, intensity, frequency, and duration of a dose of exercise are all critical. One person's healthy, vigorous workout could be hazardous to another. These dangers may be greater in pregnant women because they are more likely to have strains and other serious side effects for the would-be mother. However, if exercise will be implemented and carried out in a normal, average range, exercise will not have an effect on the overall condition of the pregnancy and especially on labor or delivery. Pregnancy. Quality prenatal care should be given to a mother during her pregnancy. She should be prepared for the normal delivery of a healthy baby. Complications should be prevented at all costs. All of these things are boiled down to the fact that a pregnant woman should be cared in such a way that she will not be compelled to do vigorous work but should not also stay in bed and be inactive until she gives birth to her baby. Consequently, a pregnant woman's condition varies in relation to the growth and development of the baby inside her womb. Therefore, it is necessary that proper health guidance be provided by her physician during her visit. Moreover, it is important to keep the pregnant woman's life active in order to promote good health, not only for her but also for the baby most importantly. Physical conditions like blood pressure, weight and health status is usually monitored during the pregnant woman's visit to her doctor. For this reason, it is significant to note that exercise can be the #1 factor in order to keep these aspects in good condition. As the health experts contend, adequate physical and emotional information is needed by a pregnant woman to prepare herself for delivery. She needs practical health messages in keeping herself and the baby healthy. Hence, for mothers or would-be mothers who are not yet aware why they should exert some effort in engaging into moderate, normal exercise, here is a list of some of its benefits so that you will be able to understand the reason why pregnant women have to exercise regularly. Number 1. Defiance against fatigue. As muscle becomes fatigued, it produces less force. To accomplish a task like climbing the stairs, for example, or shoveling snow, more units of muscle must be called into play to back up the wearied muscles. The tired muscles are both less efficient and less effective. Hence, this will just put more strain on the pregnant woman because of the weight that is continuously adding up each day. That is why tired muscles will usually result to leg cramps or sore muscles. What every pregnant woman must know is that exercise improves the condition of the muscles and their ability to work longer without fatigue. Number 2. Reduce backaches. Even when you sit or stand, some muscles are working, and such relatively easy postures can tax some muscles and cause fatigue. The muscles of the lower back, for example, can be exhausted and worn out by the effort of keeping erect when a pregnant woman stands still for several hours. With exercise, a pregnant woman can correct this error by developing her posture. Number 3. Increase the amount of oxygen. Work and exercise rely on glycogen, a substance produced by the body from complex carbohydrates and stored muscles and liver. The supply of glycogen in the muscles determines and limits the duration of activity. Exercise depletes the glycogen in the muscles and leads to tiredness. However, when glycogen is depleted by strenuous activity, it is replaced in quantities greater than before, as if the body recognized the need to lay in a larger supply of fuel. Hence, oxidation is essential for converting glycogen to the energy that pregnant women need to wiggle a finger, flex a muscle, or practice the lungs and heart for some blowing action during normal delivery. These are just some of the many benefits exercise can bring to pregnant women. Besides, nothing is completely wrong for a pregnant woman doing some moderate exercises. The only important thing to remember is that before starting an exercise program, whether pregnant or not, it is best to consult your doctor. As they say, doctors know best. Benefits for babies. Newborns whose mothers exercise during pregnancy may become physically coordinated a little earlier than other babies, according to a captivating new study of gestation, jogging and the varying ability of tiny infants to make a fist. The study's findings add to growing evidence that physical activity during pregnancy can strengthen not just the mother but also her unborn children and might influence how well and willingly those children later move on their own. The current physical activity guidelines in the United States and Europe call for children to run and play for at least an hour every day. But, according to most estimates, barely a third of European and American youngsters are that active. Many factors contribute to this physical languor, including crowded family schedules, lack of physical education programs in schools, childhood obesity and overly ample screen time. The experts had compared the cardiac function of babies born to mothers who had been sedentary or worked out during pregnancy and found that infants whose mothers exercised developed stronger, more athletic hearts even before birth. Their pulses were slower and the beat-to-beat variability greater, a general indication of better conditioned cardiac muscles. Let's see the baby's benefits. Number 1. Reduced odds of diabetes. One study found that rats born to exercising moms had better insulin sensitivity, even once they were adults themselves. Number 2. Boost to brain health. Another study looking at pregnant mice given exercise wheels showed that the offspring of more active mice were less prone to neurodegeneration, the changes in the brain that can lead to Alzheimer's disease. Number 3. Lower BMI. When mice exercised during pregnancy, researchers found that their babies were less prone to obesity and diabetes. What's more, they saw the same effect even if the mothers ate a high-fat diet, canceling out any negative effects that an unhealthy diet alone would have caused. Number 4. A fitter heart. One group of researchers looking at human babies discovered that a regular workout routine during pregnancy helped lower the heart rate of the fetuses at 36 weeks gestation, a good thing, since a higher heart rate can be a sign of fetal distress. In 2014, they followed up that study of babies until at 1 month old and found the effects of moms exercising could still be seen in the baby's heart rates after birth. Starting your pregnancy exercise routine. Most studies on the benefits of exercise during pregnancy look at the effects of about 150 minutes of active time per week. Those sessions could be 5 half-hour sessions or 3 or 4 longer classes. And the benefits are incremental, researchers think, which means that some exercise, even if you don't hit that 150-minute goal, is better than none. Anything that raises your heart rate and gets your muscles engaged counts, including walking, jogging, yoga, Pilates, dance, aerobics classes and swimming. If you weren't a gym rat before now, don't worry, as long as you start out slowly, it's safe to start now. Begin with 5 minutes of activity a day, like a brisk walk around the block, and add 5 minutes each week until you can stay active for 30 minutes. Just be sure to follow the rules of pregnancy exercise safety, avoid contact sports and activities with a high risk of falling, like downhill skiing, horseback riding and gymnastics. And stop a workout if you get lightheaded or are unusually short of breath, feel contractions or decreased fetal movement, or have any vaginal bleeding or fluid leaking. Do you want to know more about health and wellness? Would you like to know how to live a healthy and natural lifestyle? You have reached the right place, the Natural Healthy Lifestyle channel. We really would love you subscribe and activate the bell. It would be very appreciated. And remember, we love you. So we will help you to have a natural and healthy lifestyle. Take care of your health. And enjoy life.